Hi, I'm Allie. I'm a health and wellness coach, and I primarily specialize in pregnancy and new moms. If you want to hear what I found to be helpful throughout pregnancy and being a mom, please subscribe to my channel, Paleo Preggers, for some updates and some healthy pregger tips. So in this video, I'm talking about Group B Strep. So what are the risks to either taking antibiotics or refusing them if you test positive? But primarily, I'm going to give you a few things that you can try to prevent a positive test and ultimately not have to make that decision anyway. And if you already tested positive, maybe this will give you some hope and a few things to try to get rid of it before you give birth. My first pregnancy, I did this stuff and I got a negative test. I'm a few weeks from getting that test again. And we'll definitely do this again. Warning, it might get a little bit kinky. Most women are tested for Group B Strep sometime between 35 and 37 weeks of pregnancy. And about 25% test positive, which is pretty high. Group B strep is a common bacterium that's often carried in the intestines or the lower GI tract. It's usually harmless in healthy adults, but it can cause baby to get Group B strep while traveling through the birth canal. Most babies born to women carrying Group B strep are healthy, but the few who are infected during labor can become critically ill. It can lead to life-threatening complications in infants, including pneumonia, meningitis, and infection in the bloodstream. All of those are very bad for infants. Now, in the US, if you test positive, you are often automatically treated with IV antibiotics during labor. Antibiotics during labor are usually safe, but in rare cases, they can cause severe allergic reactions like fever, nausea, vomiting, or abdominal pain. Other risks to administration include infection and antibiotic resistance, which you obviously don't want. Personally, I try to avoid the use of most antibiotic use unless it's absolutely necessary, because along with killing the bad bacteria, it also kills the good bacteria. And especially when you're pregnant, you do want your baby to get all the good bacteria in the vaginal canal. The reason the US administers antibiotics regardless is because they consider the risks of GBS to outweigh the risks of antibiotics. Many countries, and we're talking like the United Kingdom, not third world nations, they look more at some of the other risks that increase adverse effects before administering antibiotics automatically. Evidence does not really support universal treatment with antibiotics during labor either. 30% of babies in the US are treated, which is 100 times above the rate that's actually needed. And here's the catch. Even if you test positive for GBS at 35 to 37 weeks, by the time you deliver, you might actually be negative because bacteria comes and goes. 17 to 25% of women who have had a positive swab at 35 to 37 weeks will be GBS negative at delivery. Now, if you test positive, can you refuse antibiotics? Maybe. That's up to you and your healthcare team after weighing the risks. Most will push for it or require it regardless of risk factors if you're in the United States. So, the best course of action is to maintain healthy vaginal flora to prevent GBS from colonizing in the first place. Stopping GBS before your test or before you go into labor is the most promising option for most women. So I'm going to share some ways that can help prevent a positive test. And we're not really tricking the test. We're just doing a few things to help your yoni be resistant to the bad bacteria. If you already tested positive, try these and see if you can convince your healthcare team to retest you before birth, because there's a chance it will go away. So first, and this is more helpful when done throughout pregnancy, but take a probiotic. I personally use a combination lactobacillus bifidobacterium. Sorry if I brutalized that. I've only ever seen it written down. I take that throughout my pregnancy. Lactobacilli are great at fighting off the bad bacteria, and this will also help pass good bacteria onto your baby. One midwife found that a particular strain called L. rhamnosus is particularly effective in combating GBS, so that's also something that you could try. If you already take these internally, great. If you don't, you can certainly start. Improving your gut is always great. And if you're planning to breastfeed, adding this good bacteria is still beneficial to pass on to baby. So I'll put the links to these probiotics in the description if you're interested. Number 2, stick the probiotics in your yoni before bed. Now, you're probably like, what? But yeah, just stick a capsule up there before bed and it will all be absorbed and you're adding some great bacteria to your vaginal flora. If you don't want to do this, you can also break up the capsule and spread it in your underwear before bed. Personally, I'd rather just shove it up there. There's plenty of other stuff that I find down there in the morning. But to each their own, whichever you prefer. I think they both have the same effect. Before I move on to number 3, don't think I have a weird fetish about sticking edible stuff in my vagina. I swear this stuff is recommended by midwives. So number 3, garlic is another thing that has properties known to kill Group B Strep. You can up your diet with it, but you can also put a garlic clove into your cooch at night. This one you will have to take out in the morning. I have also heard of people putting yogurt or kefir up there. That doesn't personally interest me and I'm not recommending it, especially because you don't want to add sugar anywhere near your yoni. Just letting you know if that's all you got. Some people do it. I am definitely more wary of it though, and it would have to be unsweetened, etc., just because bad bacteria does feed on sugar. So here's what's recommended the week prior to the test. This is what I did in my last test. This is what I plan to do this time as well. If you only have a few days, still try it, but ideally you want to go for a week. So the first night, you stick a probiotic in your yoni or break it up in your panties. The next day, you put a garlic clove in there. Just again, remember to take it out in the morning. And you alternate doing this in the days leading up to your test. So this might not be the best week to get kinky with your mate, or maybe it's the opposite. It could be a fun, unexpected surprise. You into garlic like that? But up to you. Number 4, bump up your fermented foods in your diet. So yogurt, kefir, sauerkraut, kimchi, beet kvass, kombucha. This all feeds the good bacteria in your gut and makes it more diverse. Number 5, lower your sugar, flour, and vegetable oil intake. Anything inflammatory feeds bad bacteria populations, and you are trying to minimize that. So, sugar, flour, vegetable oil, these are things that feed the bad bacteria. What feeds the good bacteria, and something that you want to do regardless if you're taking probiotics, is increase resistant starches. Good bacteria love them. So the best resistant starch is to cook rice or potatoes and then refrigerate it for 24 hours. So this cooking and cooling of the starches creates resistant starch. So you can reheat. That will sometimes even add more resistant starch, but once you introduce this good bacteria to your system, you do want to feed them so they can fight the bad bacteria. And again, these are all good tips anyway to keep a healthy gut. So if you're taking probiotics, this is a great practice. And as an FYI, these last few diet tips are also great for you to do if you do need to take antibiotics, because they'll help repopulate the good bacteria in your gut. And you definitely want to do that for yourself, and your baby will also get the benefits, especially if you're breastfeeding. An important note here, never douche. It damages the mucosal lining of your vagina and it's counterproductive. So after you stick this stuff up there, don't wash it out. Lastly, and I know not everyone can achieve this, but apparently if you're able to have a water birth, a number of studies show that giving birth in water reduced the risk of baby contracting GBS from low-risk moms. So that could definitely lower the risk if you're able to do that. So those are my tips for improving the health of your vagina and preventing a positive Group B Strep test. You can certainly continue to do this in the weeks leading up to birth as well, whether you test positive or negative. If you try this, let me know how it works out for you in the comments, and please share this video if you know anyone else getting ready for the test and is nervous about it. If you want more pregnancy and health tips, please subscribe to my channel, Paleo Preggers, and hopefully I will see you next time. Bye.